Hi, how are you? Today I'm going to talk to you about CBT, Cognitive Behavioral Therapy. We're going to talk about what is it and what to expect when going to this type of psychotherapy. Hi, if it's your first time here, welcome. My name is Adi and I'm a registered psychologist. I have a master's degree in clinical psychology and I help people achieve the life they want by overcoming the struggles and difficulties of everyday life. Here on my channel, I help you figure out what's holding you back from the life that you want for yourself. So without further ado, let's talk about it. So I want to start with explaining what is CBT, but I'll take a step backwards, first of all, because I hear as a therapist, I hear a lot of people asking me, I want CBT, help me find a CBT therapist, or even people that approach me. And I try to understand what's in the base of their question. CBT became a buzzword a few years ago, buzz therapy, something that is it's considered the opposite from the silent Freudian psychodynamic therapy, which I'll explain in a different video what it actually means. But people started looking for a more active approach and a quicker one. So CBT became kind of the term for a faster and maybe more effective and more tip-oriented therapy. But it's not true. It is different from the classic therapy that we know from what we've seen on TV, from maybe the silent psychologist. It's something that works in a different direction, but it doesn't mean that it has to be short term. It doesn't mean that it's going to give you advice, and it's not, and that's the most important thing, it's not a quick fix. When it comes to our mind and our soul and what we feel, there's no quick fix. If there was, I wouldn't be in this profession. We didn't have this profession. I wish there was. So I want to explain, and I'm going to start by defining CBT. So cognitive behavioral therapy. It's a form of psychotherapy that focuses on changing dysfunctional emotions, behaviors, and thoughts. How do we do that? We try to interrogate and understand negative, irrational beliefs. We all see the world a certain way it's based on how we've grown up, the house we've been in, our parents, and it's very important to understand how we see the world, because sometimes when you hear someone saying any kind of phrase to you and you interpret it a certain way, then you have a certain belief. Another person would hear something completely different. Have you ever sat with a friend and you both heard the same thing, but each and every one of you understood something different? That's our perception. Our perception is different. CBT actually aims to understand this perception and see what we can do with it, because the way we see the world is what causes us the most suffering. So it is more solution-oriented form of the classic talk therapy. CBT is resting on the idea that thoughts and perceptions influence behavior. If you're feeling distressed, in some cases, it might distort the way you perceive the reality. So CBT aims to identify harmful thoughts, assess whether they are accurate depiction of reality, and if they're not, then try to imply. So let's talk about what is different from the psychodynamic classic approach. The classic psychodynamic approach is insight-oriented, past-oriented. It focuses on what happened to you and what you went through that built you the way you are today. The CBT approach and the cognitive behavioral actually focuses on present day. What you're thinking about right now, what you were thinking when you were starting to feel anxious or depressed, what happened to you before the exam, what you thought about it. The goal is to understand what happened to your brain, what shifted, what changed that brought the anxiety, that brought the distress. So it does not focus on your past, but it focuses on here and now. So I want to talk to you about what to expect when going to see a CBT therapist. So at the start of the therapy, the CBT-oriented therapist probably will ask you about your past, try to understand where you come from, to have the foundation to get to know you. But the focus of the sessions will be on understanding what is happening inside of you, inside of your mind, when you feel distressed, when your emotions run high. And it's about increasing your awareness of how you think. What do you do when you get anxious? What do you do when you feel stressed or depressed? It's going to be around the topics of what is your brain focusing on. It might the therapist might ask you, can you tell me what's going on while you're going down the rabbit hole, when one thought leads to another, which goes into a spiral that never ends? How do you talk to yourself when you're feeling depressed or when you're feeling like you can't get out of bed? What are you telling yourself? The idea is to understand your thought process and your mind. So the idea is awareness, to start being aware of our thought process, of our emotions, of what happens when our partner imagine that your partner is telling you something, you get insulted. What happened there? What happened in your mind? How did you interpret that? By being aware of that, you can start noticing. And then once we've talked about the cognition part, we go to the behavioral part. We start thinking about new ways of thinking what was being said. Give another interpretation to what you might have heard. And then behaviorally, you start next to the awareness, noticing and then changing. For example, if you got insulted by your partner telling you that they can't stay for dinner, you got insulted because you perceive it as they don't care about you. So with your therapist, you can talk about it, and it's probably a thought that keeps coming back to you in many situations. We can start giving new interpretations. So maybe they do care about you, but they really have to do the other thing. Maybe they're committed. Maybe they don't know that you get insulted. We're going to give other interpretations that you can adapt to yourself. Now, you would think, okay, that's great. Then I'm going to adapt it and I'm going to feel immediately good. But it doesn't work this way. Again, our minds, our spirits, our souls, us as humans inside, we're complicated. It's not as easy. So you need to be patient. And the more you do it, the more you practice it, the more you start challenging your thoughts, it's going to get better. So the last part today, I want to talk about how you can start implementing and apply CBT to your life. You can go to a therapist that will help you, but you can also do these next steps in noticing and doing it yourself. Start challenging your thoughts, start being more aware. So the first thing would be, if you start to get overwhelmed by emotions or pain, the first thing I want you to do is to ask yourself the next question. What is going on? What am I anxious about? Why is my pain flaring up? Why is it more strong? So I want you to see if you can figure out what is the thought process, what ignited it. It starts to be like a self-talk. I want you to hear it and see that it kind of gets ruling of the situation. It's taking over the situation. Second thing, I want you to think if there's a real problem to fix. Start asking yourself, why am I depressed? Why am I anxious? What is going on? For example, your parents need to pick up your child from school and they haven't called that they've done it, and you get anxious. Your spouse said something that caused you to feel depressed. Your back is hurting and it makes you more low on your energies. Why is it important? Because you can take action. That's the behavioral part I talked about. Because yes, you can pick up your phone and call them, ask them, see what you can do. You can go lie down. You can go to the doctor. What we usually do is we ruminate. We start thinking over and over and over. We don't stop asking, what is the real problem? Can I take action? So the second thing would be take action on the problem. But what do we do if there's not a real problem? if the problem is irrational. So here's what you can do. If you can't pin down a specific problem, or you can't find a specific cause for what you're feeling, then it's irrational. You're worried that you'll get sick because you've touched a doorknob, which these days we can all relate. Maybe you'll get run out of the work that you're doing because you didn't do what you thought was expected out of you. So you can start journaling. Write down the irrational thoughts. Write down what is your mind thinking, and then start engaging with a rational thought, with your rational mind. Write down what is irrational, try to answer it. What it does, it calms you down. You don't even need to write it down. You can take a deep breath, close your eyes, take a moment. The idea is to take action that will calm the thought process down, that will make you think more rationally. The last tip is start anytime, anywhere. We get so caught up with what our mind is telling us. But remember, that's the problem of the hour. Next one, we're going to have a different one. Next year, it's going to be something else. We usually go back to the same thought processes on every situation. So identify it, take action, listen to your thoughts. Make friends with the enemy. Make friends with anxiety, with depression. Understand what is your mind going at and start acting on it. I do recommend seeing a therapist if it does feel like it's overwhelming and it's not possible doing it alone. Usually it is very difficult, but you can start by yourself. CBT is all about helping you control your life. You're not going to control if you're going to get anxious or depressed, but you can handle it. You can manage it. You don't need to get run down by your thoughts, your mind, your soul, and your emotions. So I'm very happy you came here today. I hope it gave you something. I hope you saw value out of it. Maybe you've learned something. Maybe you just educated yourself. I'm going to be here next week on Tuesday, like every week. So if you liked it, hit the bell button so you can get notified whenever I upload new videos. Like this video so you can get more videos like this. It does support my channel. And subscribe. Every week I'll be here. Until the next time, stay safe, stay well. Bye.